Then coming to the second step of the removal of unabsorbed poison from the body in case of ingestion route, that is the gastric lavage, also called stomach wash, that is washing the stomach. As per the American Academy of the Clinical Toxicology and the European Association of Poison Centers and Clinical Toxicology, they have prepared a draft of a position paper directed to the use of the gastric lavage, which suggests that gastric lavage should not be employed routinely in the management of poisoned patients. This, I think, is a breakthrough, especially in the Indian scenario regarding the management of the poisoned patient, because once whatever the poisoned patient comes to a hospital, either in the emergency or casualty, the gastric lavage is the first step that is mostly done by the doctors. But the current guidelines says that gastric lavage should not be employed routinely in the management of poisoned patients. The study says that there is no certain evidence that its use improves the outcome, while the fact is that it can cause significant morbidity and sometimes mortality. So, lavage should be considered only if the patient has ingested a life-threatening amount of a poison and presents to the hospital within 1 to 2 hours of the ingestion. So, only indication of the lavage, doing the gastric lavage, is if the patient has ingested a large amount of the poison and the present to the hospital within 1 to 2 hours of the ingestion. So, this shall be kept in the mind. Especially for India, it is high time that we should change this scenario and we should convey not to use routinely the gastric lavage. But one place where it is the useful is the collection of the sample for the chemical analysis. So, for that purpose, it will be still required. In the place we may send the blood and other samples, but for the management purpose, gastric lavage is no more recommended. Now, with the advent of poison control centers and provision of enhanced emphasis on the toxicology in the new undergraduate medical curriculum framed by the NMC, there is hope of the change in the attitude in the years to come regarding the use of the gastric lavage and the updating the knowledge and information according to the time. Routinely, the indication where the gastric lavage to be done is the mainly on the patient who has ingested the life-threatening dose and who exhibit significant morbidity and presents within 1 to 2 hours of the ingestion. Lavage beyond this period may be appropriate only in the presence of the poisons that had caused that has the gastric concoction, that is gastric collection due to the adherence to the mucosa. In those poisons, it may be delayedly done. Then those cases where there is a delayed gastric emptying, then the sustained release preparation, in those cases also it can be done in the late presentation when it is very clear that this particular substance has been ingested and the nature of the particular ingested substance is this one. In those cases also, gastric lavage may be done beyond 2 hours. Some authorities recommend that lavage up to 6 to 12 hours post ingestions in the cases of salicylate poisoning that gets collected, tricyclic antidepressants, carbamazepines and barbiturate poisoning. Then the certain precautions that shall be taken while doing the lavage or should not be done, never be done. That includes the ingestion of the non-toxic agent or a non-toxic amount of a toxic agent. In those cases, gastric lavage shall not be done. Never use lavage as a deterrent to the subsequent ingestion. Such a notion is barbaric besides being incorrect. So the lavage shall also be not done for just for to teach the person that so that he doesn't consume any chemical again. This is the wrong practice because lavage itself can be life threatening. So why it is not recommended? Because of the its complications that are associated with the lavage. Rather than, and there is not much benefit after 2 to 3 hours. So it is unnecessary waste of the precious time as well as putting the patients at the risk. Now the certain major contraindications for the doing the lavage. As per the earlier guidelines, lavage is absolutely contraindicated, as we all know, in case of corrosives poisoning, because corrosives causes the damage to the mucosa of the esophagus and the stomach. So during the lavage there will be the risk of the tear of the esophageal or stomach mucosa. So it shall not be done in the poisoning of the corrosives. Whereas in case of the organic acids, even though it is a corrosive, it causes the thickening of the stomach mucosa. So there it may be done, like in case of carbolic acid. So absolute contraindication is a corrosives except the organic acids. Then the sharp and the pointed materials are the another absolute contraindication, because during the efflux or during the taking them out, it may cause additional damage to the mucosa of the stomach or esophagus. Then marked hypothermia is the contraindication, as it may further cause the hypothermia. Then if the patient already has significant vomiting, then also it is not preferred method, as it is already the amount of ingestion has got vomited out. Then in case of unprotected airways, in case of coma or ingestion of the convulsant or petroleum distillate, it shall be avoided. Then certain relative contraindications, where this method may be done with certain precautions like cardiac arrhythmias, because it predisposes for the cardiac issues, cardiac arrhythmias, so it is a relative contraindications. Then in case of children, in case of comatose patients, in case of convulsant poisons, because it can cause the predispose to the convulsions. Esophageal varices is another contraindication, and it will cause the further bleeding or damage to the vessels. Then the person with a hemorrhagic diathesis may have the further bleeding, so it shall be avoided in those cases. Hypothermia, already we talked. Then kerosene poisoning is another relative contraindication, as it may cause the inhalation of the ingestion on the respiratory tract of the kerosene while doing the gastric lavage, so leading to the chest infection or the aspiration pneumonitis. Then the patients who are arriving late, that is more than 3 hours, as we already learned, it is of no use. Then the advanced pregnancy is the relative contraindication. Then recent surgery is another relative contraindication, where the chances of the sutural damage or the sutural prolapse may be there. Then volatile poisons is the relative contraindication, because it may cause the inhalation of the poison in respiratory tract and the other problems like aspiration and the pneumonias. Then already vomiting patient, it is again relatively contraindicated. Then the ingestion of the alkali or acids, they all fall in the same line, they are relatively contraindicated. Then the procedure to perform the gastric lavage, we shall know this is very important, being the clinician or practicing in the management of the poisoned patient. First step to doing the gastric lavage shall be to explain the patient about the procedure and obtain his consent. If the patient refuses, then it is better not to undertake the lavage because it will amount to an assault and besides increasing the risk of complications due to active non-cooperation. Then endotracheal intubation must be done prior to the lavage in the comatose patients. Place the patients in the head down position, that is called Trendelenburg position, that is tables of the feet side should be slightly above, around 20° tilt on the table. Mark, then the step shall be you have to take the lavage tube and then mark the length of the tube that has to be inserted. Usual recommended length is the 50 cm for the adult and 25 cm for a child. If it is not marked or there is a difficulty in the measuring the length, then the length corresponding to the length distance from the xiphoid process and the bridge of the nose. So, this length from the xiphoid process to the bridge of the nose is taken and this length shall go inside the body. Then the selection of the ideal tube for the gastric lavage is also very important. Usually, it is observed that if the lavage tube is not available, then the doctors are using the nasogastric tubes to perform the lavage. This is dangerous and this shall not be done. Because ideal tube for the lavage is the lavacuator, a clear plastic or gastric hose that has as you can see in this photograph, this is the lavacuator. So, a lavacuator has the two openings. One is for the suction connector that has the wider lumen and another is the irrigation vent connector that has the narrower lumen. And then further there will be the different markings where it will indicate of the depth so that we can put 50 cm inside the body. Then there are two vents in that. One is the irrigation vent on the end near the end side and the suction vent at the tip and on the lateral sides of that tube. So, this is the lavacuator. This is the best tube to be used for the gastric lavage. The commonly used tube is the Lavage tube. As you can see, this is the Lavage tube where there is a funnel to give the saline or water, and then this is a pump for the suction pump for the creating the suction pressure, and then it will be taken out through this funnel out. So, this is the preferred tube for the stomach wash. In India, Lavage tube is often used, which is a soft rubber tube with a funnel at one end. We should keep in mind that whatever tube is used, make sure that the inner diameter corresponds to the at least 36 to 40 French size. French size is the size approximately 1 French is equal to 1/3 of 1 mm. So, 1 mm is equal to approx 3 French size. So, 36 to 40 mm will be around 12 mm to the 1, you have to divide by 3. So, 3, 1, so the inner diameter should be of this much of minimum of whatever tube you are using. In a child, the diameter should be at least 22 to 28 of the French, that is 7 to 10 mm of the inner diameter should be there. The rice tube may be sufficient in case of children's. But the nasogastric tube is inadequate for the adult and should never be used. This shall be kept in the mind. Then the preferred route of the insertion is the oral, not the nasal. This is also the mistake that the people are doing. You should pass the tube through the oral route because passing the tube nasally can damage the nasal mucosa considerably and lead to severe epistaxis because it is wider, it is not a nasogastric tube. Before the inserting the tube, lubricate the inserting end of the tube with a Vaseline or glycerine and pass it to the desired extent. In the mouth, use the mouth gag so that the patient doesn't bite on the tube. Once the tube has been inserted, then its position shall be checked either by air insufflation while listening over the stomach, as we do that. Once the tube is in place, then you insufflate some air through the syringe and you auscultate over the jiffy sternum or the epigastric region. If there is a whoosh passing of the air sound, then it is suggestive that the tube is in the stomach only. Also, the clear indication are seen, like the coughing will be there if the tube goes into the respiratory tract, and that will be persistent. Then the aspiration of the fluid from this Ryle's tube will be acidic nature if it has been correctly polished, because we have to look also that it goes in the stomach only, not neither it goes beyond, not it is very up. So, if it is properly positioned, then the pH that we find in the aspirate will be of acidic nature. Then lavage is carried out using small quantities of the liquid in a frequent dosing. In an adult, around 200 to 300 ml of the warm saline or a plain water is given. In a child, 10 to 15 ml per kg of the body weight warm saline is used each time. Water should preferably be avoided in the children, young children particularly, because of the risk of inducing hyponatremia and water intoxication. So, it is advisable to hold back the first amount of the washing of the chemical for the chemical analysis. Then, this is the photograph that from this you can learn the what steps shall be followed in case of gastric lavage. So, the patient should be made into the left lateral position. Bed should be in the Trendelenburg position, that is, head should be lower and feet end should be higher. A little of the 20 to 30 degree of the tilt is sufficient. Then you have to use the Eval's tube. The end of it shall be applied the glycerine or the other lubricating agent. Then you put in the mouth end and then go after at the mark side up to the 50 centimeter in case of adult. Once you reach in the up to the 50 centimeter, then to confirm whether this is placed in the right place, you use the either you look for the cuff reflex or you use the insufflation of the gas through the syringe and listen over the epigastric region. And other way could be the looking for the acidic pH. All these will suggest that the gastric lavage tube is in the right place. Once you are sure that this is in the right place, then we should now perform the gastric lavage. So, the way to perform the gastric lavage is that the tube, that Eval's tube that we saw, it had the funnel end and it had the suction bulb. So, the first step shall be that you pass around 250 ml of the plain warm water or normal saline through the funnel held high above the head. When the funnel gets empty, then pinch the suction bulb and then you put down the funnel in down into the bottle, and once you will remove this suction pressure over the suction valve, it will suck out the fluid from the stomach and the fluid will come out in the jar in the siphon mechanism or the suction pressure due to the negative pressure that has built due to the suction bulb. So, the fluid will from the stomach will be teed out in a siphon action mechanism. Now, the first sample that has come out from the stomach shall be preserved for the chemical analysis. This solution should be handed over to the police in all cases of poisoning, whether suicidal, accidental, homicidal, by the either government or the private hospitals. The proper method of the preservation and the sealing and the chain of custody maintenance shall be done by the hospital or the doctors. The precautions that shall be taken while performing the procedure is that in case of bleeding or any of the major issue complained by the patient, the procedure should be stopped. For the subsequent washing of the stomach wall, the lavage fluid that shall be used can be depending upon the cases. Normally, the normal saline of about 50 to 100 ml in young children, 150 to 200 ml in adolescent is then introduced, and again the stomach is washed. Other suitable fluids that can be there, we will come to later, but once the lavage got completed, then the thing that must be remembered that pour a slurry of activated charcoal mixed with the water about 1 gram per kg and an appropriate dose of ionic cathartics into the stomach and then remove the tube, because putting the charcoal and cathartics will cause the removal of the excess toxicant through the diarrhea, as well as the intrahepatic circulation that will come into the stomach, that also will be cleared by the activated charcoal that will remain there. So, once the lavage has got completed, then the activated charcoal mixed in the water shall be left in the stomach. Then the different types of solutions that are used in different types of poisoning, that are the calcium gluconate, lactate or another calcium salt in case of oxalate poisoning, castor oil with warm water in case of phenol or carbolic acid poisoning. In case of phosphorus, copper sulfate is recommended. For iron, deferoxamine. Cyanide poisoning, hydrogen peroxide. In general, potassium iodide can be used for the stomach wash. Then the potassium permanganate is very important for the gastric lavage, because it is very commonly used and very commonly applicable in major of the poison that are household poisons. So, it is useful in the oxidizable poisons like alkaloids, phosphorus, salicylates. Then normal saline, already we talked, is not commonly used, and in case it is nature of poison is not known, at those places saline washing is good. Then saturated lime water may also be used. Sodium bicarbonate, sodium iodide, tannic acid, all they may be used in the case of unknown poison or of which nature is clear-cut guidelines is not there. Then for cyanide poisoning, sodium thiosulfate is recommended. Now, when to stop doing the gastric lavage is a very important step. This step is decided when you are using what type of fluid you are using. So, when you are using the normal saline or any clear fluid, so once the clear fluid starts coming, which is odorless and is same in nature that the fluid that has been introduced, in those cases we should stop doing the lavage. This indicates that there is no further interaction between the poison and the antidotes. Particularly in case of potassium permanganate, KMnO4, the returning fluid is initially colorless because potassium permanganate oxidizes the poison, and in this process itself gets reduced to a colorless compound. So, initially the potassium permanganate solution becomes the colorless, and when we are doing lavage with the potassium permanganate, then the returning fluid will be once the pink color, that means there is no more poison there. In that case, the color will be pink color, and then we have to stop the doing the lavage. As I already told you that after the completion of gastric lavage, activated charcoal and cathartics shall be left in the stomach, so that the poisons who are left or those who are coming through the enterohepatic circulation into the stomach will be neutralized further. For that purpose, potassium permanganate may also be used in the amount of 250 to 300 ml that shall be left in the stomach after the doing the lavage, particularly in case of poison like morphine and heroin. That will take care of the poisons that are coming through the enterohepatic circulation, or that will be remaining later also. Even in cases of the poisons that are administered parenterally, the gastric lavage may be useful for this reason only, that some poisons who have been injected parenterally reach to the stomach through the enterohepatic circulation. So, in those cases, the gastric lavage may be useful. Late lavage, as I already told, that late lavage may be useful in certain poisons who are getting adhered or getting collected in the stomach, or that those causes the delayed gastric emptying, like producing pyroluic spasm in cases of antihistaminics, barbiturates, morphine, phenothiazine, tricyclic antidepressants. Also, the salicylate poisoning, where the poison get collected forming a cake like a doughy mass. So, in those cases, even late lavage may be helpful, as the poison remains in the stomach up till long duration. Then I already showed this is a Eval's tube and this is the Lavage curator. So, we must preferably use these two tubes only for the gastric lavage purpose. Then the important thing is what are the complications that could be possible in case of gastric lavage. The gaspiration pneumonia, that is the stomach content may be aspirated. So, that will cause infection to the lungs, and that is the aspiration pneumonitis. Then the person may go into the bradycardia, laryngospasm may be the problem, cardiac arrhythmia and cardiac asystole, sinus bradycardia and ST elevation on the ECG may be seen because of the gastric lavage. Then epistaxis, nasal bleeding, hypocholeремia because of the extra removal of the chloride ions, hyponatremia for the same reason, hypoxia, hypercapnia, Mallory-Weiss syndrome, that is tear of the esophagus and the stomach wall, mechanical injuries due to the tube and the procedure, forced method if applied, then metabolic alkalosis because of the acid that has been taken out. So, metabolic alkalosis may be there, perforation of a stomach and esophagus, although it is rare. So, after the gastric lavage, the next method that we can use is the cathartics. Cathartics is the very appropriate term when used in connection with the poisoning, since it means the purification. It is achieved by purging the gastrointestinal tract. That is you may understand, catharsis is basically the producing the diarrhea, loosened stool, so that the poison gets out of the body through the excretion. So, it is achieved by purging the gastrointestinal tract, particularly the bowel, of all poisonous material. The two main groups of cathartics includes in toxicology are the ionic or saline water. These cathartics alter the physiochemical forces within the intestinal lumen, leading to the osmotic retention of the fluid, which activates motility reflexes and enhances the expulsion. However, excessive dosage of magnesium-based cathartics can lead to the hypermagnesemia, and which can be a serious complication. You can remember my teacher used to tell that magnesium you can mug, Mg is the magnesium is the compound that you will have to, if you are taking any magnesium compound, so you will have to run in the toilet with the mug. So there is a diarrhea. Whereas if you are ingesting any compound with the calcium, so there will be C constipation. So C for constipation, calcium compound causes constipation and magnesium compound causes the diarrhea, that you will have to run with the mug. The doses recommended for the cathartics are for the magnesium citrate, it is the 4 ml per kg. Magnesium sulfate is 30 grams, 250 milligram per kg in a child. Sodium sulfate, it is the 30 grams, 250 mg per kg in the child. Then saccharides like sorbitol, D-glutol is a cathartics of choice in cases of adults because of its better efficacy than the saline cathartics, but must not be used as far as possible in the young children because of the risk of the fluid and electrolyte imbalances, especially the hypernatremia. It occurs naturally in many ripe fruits and is prepared industrially from the glucose, retaining about 60% of its sweetness. Sorbitol is used as a sweetener in some medicinal syrups, and the danger of the complication is enhanced in overdose with such medications when sorbitol is used as a cathartics during the treatment. Magnesium sulfate may produce CNS depressions in cases of renal failure, so it shall not be used in cases of person with the renal failure. According to current thought, cathartics should never be considered the part of the routine management of the poisoning. Following important principles shall be kept in mind regarding the cathartics. That is, if poison is absorbable by the activated charcoal, a cathartics, if given with activated charcoal, is as efficacious as activated charcoal alone. So, this is not of major point to be giving it. Then, if poison is not absorbable by the activated charcoal, in those cases, whole bowel irrigation is better than the cathartics. So, whole bowel irrigation is a better method of choice than the cathartics. When the cathartics may be given only when the facilities for the whole bowel irrigation is not available. The cases where the whole bowel irrigation and the certain cases where this cathartics may be useful compared to the whole bowel irrigations are in cases of the sustained release preparation has been ingested, or poison not absorbable by the activated charcoal, large amount of the poison has been ingested, and the desorption from the activated charcoal is the possibility as with the aspirin. In those cases, the cathartics may be employed. Then the whole bowel irrigation for the unabsorbed poison removal from the body. Whole bowel irrigation flushes out the entire gastrointestinal tract in 4 to 6 hours. It was originally developed to clean the large bowel before surgery or colonoscopy. This is a method that is being increasingly recommended for the late presenting or with overdose where the several hours have been elapsed since the ingestion. It involves the instillation of large volume of suitable solution into the stomach through a nasogastric tube over a period of 2 to 6 hours, producing voluminous diarrhea. Initially, a solution of sodium chloride, potassium chloride and sodium bicarbonate was used, but it was absorbed by the body, leading to complication. It induces a liquid stool. Today, a special solution are used such as the osmotically balanced macrogol solution, glotitally colloid, that contains the polyethylene glycol. Macrogol is the international non-proprietary name for the polyethylene glycol. It should not be used routinely in poisoning situations. Important indications for doing the whole bowel irrigation is the ingestion of the large amount of toxic drugs in a patient presenting late, that is more than 4 hours of the exposure. This is the first important indication. Then overdose with the sustained release preparation. Then ingestion of the substances not absorbed by the activated charcoal, particularly heavy metals. Then ingestion of the foreign bodies such as miniature disc batteries, but like button cells, cocaine filled packets in cases of body packers, that we will come when we will be talking substance abuse. Then ingestion of slowly dissolving substances like iron tablets, paint chips, bezoar, that is collection of hairs, concretions. These all conditions may be favorable for the whole bowel irrigation. Then the procedure for the whole bowel irrigation, as we already talked, involves the installation of large volume of suitable solution into the stomach through the nasogastric tube over a period of 2 to 6 hours, producing the voluminous diarrhea. Whole bowel irrigation involves the rapid administration of large volume of the polyethylene glycol that doesn't react with the any body's mucosa, and it gets completely excreted out so that it doesn't causes the electrolyte imbalances. The solution, that polyethylene glycol that shall be administered, shall be at a rate of 500 ml per hour in the children and 2 liters per hour in adolescent and adult. The procedure continues until the rectal effluent is clear. If patient vomits, infusion must be slowed down or an antiemetic shall be given. For the antiemetics, metoclopramide IV at the dose of 10 mg in adults and 0.1 to 0.3 mg in children can minimize the incidence of vomiting. There is some evidence against the simultaneous administration of activated charcoal with whole bowel irrigation. Since polyethylene glycol has been shown to reduce the absorptive capacity of the activated charcoal in vitro. So, polyethylene glycol and the activated charcoal shall not be used simultaneously. Then certain complications that can happen with the whole bowel irrigations are the abdominal distension and the cramps, vomiting and anal irritation. Certain condition where whole bowel irrigation is completely contraindicated is the bowel perforation, bowel obstruction, clinically significant gastrointestinal hemorrhages, ileus, unprotected or compromised airway, hemodynamic instability, uncontrollable intractable vomiting. All these conditions are contraindication for the ingested for the whole bowel irrigations. Then the last step that can be applied is for the unabsorbed poison is the endoscopic gastroscopy or the surgical removal. As the name suggests, surgical removal means that you are opening the stomach and removing the contents from the stomach. So, you are making an opening in the stomach, gastrotomy, and you are taking out the poison. And in the endoscopic gastroscopy, through the endoscope, we are looking at the poison and taking that out. This is indicated in cases of button batteries, cocaine packets, mechanical bowel obstruction cases, massive iron overdose, iron bezoars may develop, lead ball poisoning. In such cases where there is a clear poison may be seen and it has obstructing the wall lumen, then in those cases this endoscopic gastroscopy or surgical removal may be indicated. Over the years, a few case reports have presented with a mixed result for the endoscopic removal of drug packet from the stomach, as in the body packers with the cocaine or heroin, At present, this method is not generally recommended because of the concern about the packet rupture. However, under the exceptional circumstances, there is certainly a precedent for attempting this procedure in highly controlled setting such as in the ICU or in the operating room. Laszlo and his colleagues from the Budapest described a peculiar case where a 17-year-old male accidentally ingested the fishing weight. You can see along with the fishing nets some weight are used. The 17-year-old boy ingested those weight used in the fishing net made of the lead compound. It was retained in the stomach, causing the serious lead poisoning and the liver toxicity. The foreign body could not be removed by any means or even by the gastroscopy. So, therefore, a gastrotomy was carried out in that patient and it resulted in his complete clinical recovery. So, with this is all for today. Thank you so much.